This next part is going to talk about how to use the theracane for cervical patterns. The most common part that we use here is this knob in the end. There's other protocols that we can cover in future videos, but for right now, this is the main protocol. Essentially, I'm gonna pin the same lower muscle that we were just doing with the lacrosse ball, and I'm pulling into the muscle and slightly up. So if that muscle tissue is my fingers, I'm pulling into it and then dragging across, creating a little bit of shear. I'm not just pushing straight into it. That's the important thing to understand with this. You're not just compressing tissue straight in, you're compressing and then slightly shearing. So you're going at maybe a 45-degree angle, if that makes sense. So again, I'm finding an area, I'm gonna push in and then pull it to the side slightly. It's much more effective than just jamming it straight in, okay? So into the side, and I'm gonna hold this, and I can cross friction, so it feels like I'm pulling this against ropes, and I can pull this back and forth in a very, very small amount of movement, and I can do this until it's less tender. And I'd work this in the upper part of the trap and levator scapula for probably at least 30 seconds, or until it's not as tender. You can add some movement with this, so you can bend the head straight down, or you can bend the head down and to the right. And now a lot of the movements we're going to talk about when you're affecting a certain side back portion of the neck is to stretch those muscles and to accentuate the load of one of these instruments. You're going to pretend that you're trying to put your nose in your pant pocket on the opposite side. So if I'm compressing down here, I'm going to turn my head and tilt it down like I'm putting it in my pant pocket. And I'm gonna move around to some different areas, and I can alternate how I do this. I can go a little faster. If it's more intense, I might have to go slower. And I'm working my way up, and as I start to go to the lower part of my neck here, I'm gonna hit more of the side of my neck as well. And now I'm gonna tip away, nose into pant pocket. So I go back to neutral, put pressure in, so compress in, slight little shear without trying to fall off the muscle. And I can go through this whole area like this. Now, there's another tool that's a little more effective as you go higher up on the neck, a shiatsu neck massager. These flip and turn for different parts of the neck. This is really good for the side part of the neck and the upper neck. If you orientate this so that the smaller part of the ball is down, see this is the bigger part, smaller part, so the smaller part is down, that's what you're gonna use when you're working on the lower part of the neck and the mid, and even as you get to the upper, you're actually gonna flip it. I'll show you that in a second. So you start with the lower part of the neck, and I'm compressing in with this. This will naturally compress in and shear at the same time. You don't even really hardly have to try, but you can push in, and then you're gonna flex straight forward. And then I'm gonna move it up a little bit, straight forward. If I find a really bad spot, I'll do it for a handful of repetitions until it doesn't feel quite as tender. You can tip side to side slightly as well. There is not a steadfast protocol of exactly how to do this. I'm giving you principles with all this stuff, and you guys can find what's most comfortable and most effective for yourself. So you can stay on the lateral part of the neck. You can come a little closer. And if you're trying to get very close to the spine, what'll happen is as you squeeze this, the handles almost touch together. Your hands almost touch together. So if you flip these around the other way, so now the bigger part of the ball is in the bottom, then notice what happened, my hands are further apart. And you can put quite a bit more force and leverage, and you can get into those muscles closer to the back part of the spine. So with this, what I like to do is compress this in and flex. And because that's pretty intense right there, I'm gonna hold it there for some time. I would hold it for 30 seconds, but for the sake of the video, I won't make you wait. Now, if you remember when we talked about the anatomy of the upper cervical spine, the skull and the atlas, how there's that scooping flexion extension, there's muscles up here called the suboccipitals that are usually extremely tight in certain postures. This posture, these muscles are clamped down, usually rock hard. So any sort of increased mid-back curve, forward head curve where the head is jammed up like this, That's a key one. There's a lot of tension up there. But sometimes even if you have a normal upright posture, some people still carry quite a bit of tension and are dysfunctional in the upper cervical musculature. That's where you can take this big side down and you can pin this essentially right off the skull. So you come right off the skull and you'll almost feel like you're still on bone, but you're not. It's just very tender on a lot of people, and those muscles get so dense it almost feels like bone. So here, if you palpate, if you feel the back of your occiput, the back of your skull with a finger, you'll fall down onto a little groove. A lot of people really still feel very dense in there, but that's actually where there's muscle tissue. That's the area that you want to put this. So I'm going to fall back here and I'm going to slightly compress in. I'm probably just using, I don't know, 6 to 8 ounces of pressure, so not a whole lot. And then from here, I'm gonna tuck my chin. So I'm gonna chin tuck. I'm gonna close down my jaw and I'm gonna pull my chin down to my chest and retract. So retract is pulling my chin backwards and down, flexing my head, trying to open up these joints. So what we're doing, so you can see, is we're putting those knobs right here, and when we chin tuck, we're trying to flare that open. And as we flare that open, we are pinning that tissue and these knobs right here, and as we move, we're forcing that tissue to elongate and stretch. Very effective. I wouldn't come out too far on the side of the neck here, because then you're starting to actually hit the transverse process of the atlas, which is this bony prominence right there. So I would not come directly on the lateral portion. I would stay slightly to the back when you're working on the upper neck. Stick work you could do for a cervical pattern. It would be through these muscles as well. You usually need someone to help you with, and this is not all that aggressive, so that would only be if you were really in a ton of pain and very acute. Most people can tolerate much more than a stick, so we're not really gonna use that for the neck all that much. The neck exerciser is a really good tool for neck mobility as well. This is used for curve correction, and it's a warm-up prior to doing traction or home traction, like laying on a neck block. But this is also a very good way to get mobility and loosen up the neck. And depending on how your neck feels with these other protocols that we just showed you, you might want to go through and use a neck exerciser first to warm up. If you watch the video above, we go through this for several minutes on exactly how to use a neck exerciser. So now, in summary, I went through how all these tools can be used for different muscles on the upper part of the shoulder and parts of the side of the neck, lower neck, upper neck, and just keep in mind all the different patterns that we're trying to improve. We're trying to improve flexion. Extension is something I haven't gone into yet. Rotation and lateral bending. So you can go through those movements while you pin different areas of those muscles and apply pressure with these tools. Another thing to mention is that there is a video up above too called the 6-way neck stretch, which talks about PNF stretching, where you stretch the neck in 6 different quadrants and you contract your muscles against the resistance of your hand. So watch that video above as well. That's another great protocol to use in neck mobility. The last range of motion that we need to talk about is improving cervical extension. And if you think about this, if you can't extend backwards, there's usually one of 2 reasons as far as when you're looking at bone or muscle joint. It's either that the bones and the joints are not moving well and they're jamming down in the back, and if you get a pinching type of feeling when you come back, that's called impingement. So that's something, make sure that you tell your doctor about, because that's more of a adjustment or in-office protocol, and that's probably a good time to not go through that range of motion any further. And on a side note, I would say any of these movements that you do, if you feel a sharp pinching or if you feel any numbness or tingling or any pain going out of the arm, that's a good time to stop, talk to your doctor about it, see if we're going to improve for you to continue doing this exercise. But when you come back in extension, either the joints in the neck are going to be rigid and not allow you to come backwards. That's where using like a neck exerciser is really beneficial, or the muscles in the front of the neck are restricted, and that's what's limiting your mobility and your ability to come back. If that's the case, these muscles in here, a simple stretch you can do that's part of the 6-way neck stretch talked about in the video above is you reach your hands behind your back, so you're reaching down towards the ground, and then you tip your head backwards. But the other little tip that makes this way more effective is you underbite your jaw. So when you hit your jaw under, and you go backwards like that, you'll feel a pull in all of these muscles. This muscle is called your platysma, and there's deeper muscles in the front of the neck that are also affected when you come back in extension. These two ropey muscles here, this one right here, so if you turn, and if you take your head and your hand and you push yourself like this and you'll feel this muscle tighten. That's called your SCM, your sternocleidomastoid. The best way to address that muscle, which is tender on a lot of people that have this type of posture, or they have a reverse neck curve, these muscles are usually very tender, is what you can do is you can turn your head and you can actually take your fingers and pinch this muscle right down where it attaches into the bone here, and just gently stretch backwards. Now keep in mind, if you get dizziness, or if you feel nauseous, or if you have any extreme amount of pain, stop doing any of these exercises and let your doctor know. If you can do this and all you're feeling is tension and tightness, then likely this is effective for you. So you get a pinch and you can stretch backwards. You can do this on either side. So you're gonna rotate and then you're gonna grab the opposite side muscle and stretch backwards. I think that's a pretty good comprehensive overview of some of the muscle work, some of the hardware work that we do for improving the cervical patterns.